COVID-19 cases are rising once again, and as per reports, there is a spike in places like Hong Kong and Singapore. To understand what it means for India, I am joined by Dr. Shekhar Mande, former Secretary, Department of Scientific and Industrial Research under Ministry of Science and Technology. Dr. Mande currently is a distinguished professor at Savitribai Phule Pune University. Thank you, Dr. Mande, for joining us. Doctor, how you read the current scenario? Is there any need for us to be alarmed?
No, first of all, we don't need to be alarmed. The reports that we are getting about the strain identification in Hong Kong and Singapore and all, they're basically what is called as LF7 or NB1.8. These are sublineages of what we used to call as JN1, which itself was a sublineage of Omicron. Now, we should remember that Omicron itself was a much less virulent strain. It was not as deadly as, let us say, the previous Delta and other strains that what we saw big surge in India. And we have also had a wave of Omicron in India, which went largely unnoticed. Much of it went unnoticed. Actually, that was about a year ago. So we don't need to worry too much on multiple fronts. Number one, first of all, much of Indian population is vaccinated, double vaccine. And number two, many people have also seen the vaccine escape strains. So, and people have survived. So, in my opinion, there is no reason to worry.
During Omicron wave, I remember that majority of us got the infection. So when we talk about the similar lineage doing circulation once again, should we be expecting similar wave of infections, if not the severe illness and hospitalization?
So we don't expect hospitalizations or surge in hospitalizations or something because of the new strains that are coming in. Whether Omicron or not, we don't know because there are certain mutations that have taken place in JN1. There's something called Q453E and things like that. And whether they really improve infectivity, the final word is not out. And therefore, we are not very sure whether these are more virulent or whether they spread more rapidly or not. But in either case, I stand by my opinion that we don't need to be worried.
Dr. Mande, if you have seen the reports, it says that states like Kerala, Maharashtra, and Tamil Nadu have been seeing an uptick in cases because they have reported a few cases. Will it be right to say that these cases are coming out of these states who are reporting the numbers? Because, we understand that people are not going for active COVID testing now. So how do we read these numbers that are coming out? As per the Ministry of Health's COVID-19 dashboard, it says that we have 257 active cases nationwide as of 19th May. How you read the current Indian scenario?
So the states like Kerala and all, what you mentioned, were always good, even in the peak of COVID times. If you remember that April, May 2021, that is a serious deadly Delta wave, Kerala were reporting correct number of cases at the national portals. Ministry of Health and Family Welfare had the national portals, and essentially data was being collated at NCDC. And Kerala state, as the state in general, was doing well in reporting. Now, you said correctly that many cases are going unnoticed because of the fact that with symptoms like common cold or running nose or cough, many people don't even go to test whether it's COVID or not. Because with mild symptoms and the symptoms get better in 4 or 5 days, you don't really need to go and do COVID testing. And that's what most average people like us would do. And therefore, it is quite possible, a combination of both, that people have not tested for COVID and certain states have not probably done as good a job as Kerala has done in monitoring the situation.
So do you think that it's the time we should gear up once again and start our surveillance? I mean, we already have a level of surveillance already going around via ICMR. Do you think that it's the time that INSACOG should also start sequencing all the viruses that are currently going around in India? Do you think, because they have, I think, paused the system for gene sequencing as it is an expensive affair?
I think that's a very good question. And I do believe there is a case for active surveillance of new variants and so on and so forth, because even WHO would like to know whether there's a variant of concern that is emerging or not. There are two kinds of surveillances that we would like to propose. One is, of course, the genomic surveillance. In the cases in which a person is found to be COVID positive, then it's important that randomly we sequence some of those genomes and see whether any variant of concern is emerging or not. That's number one. Number two, while I was at CSIR, what we had done actually a pan-India wastewater surveillance. Now, wastewater surveillance actually is a very good idea, and as a practice, our country may consider doing wastewater surveillance for multiple reasons. It gives an idea of an outbreak in a particular locality or a region or a city ahead of time. It gives about 10 to 12 days notice that an outbreak is coming. But number two, even beyond COVID, things such as AMR or other infections and all can be monitored using wastewater surveillance. So both the aspects, the genomic surveillance of new COVID variants and general surveillance about wastewater, would be a good idea as a public surveillance system to put in place.
Right. What I understand, the Ministry of Health already has seawage surveillance going on, and I'm told that government is trying to read the data for the past 1 month. I think it falls under NCDC's supervision. So I think they will be able to find something if there is any immediate concern.
Indeed.
Okay. Right. And so what do you think about booster shots? It is one of the main queries that people keep writing to us, that is it a right time to take booster shots? Is there any scientific evidence behind booster shots?
So, frankly speaking, irrespective of which vaccine people have taken, whether it be around the world, either Moderna or the Pfizer mRNA vaccines, or the entire virus, inactivated virus based vaccines such as the Covaxin, or the spike protein coupled with one of the adenoviral vectors, what Covishield was, uh, no data is really available to medical fraternity about boosters are helping or not, and whether immunity had waned so much, including the cell-based immunity, what we call as the T-cell immunity, that we do indeed need a booster, and the boosters were protective. All right, so that data is unfortunately not very well characterized. People have people have attempted to get that particular data, but I don't think the final word on a booster is out yet.
So to understand the science behind the requirement of booster dosages, do you think that the current wave could be a result of the decline in the immunity levels in the humans across the world? We all have taken vaccines during, I think, 2021 majority of cases. So do you think that by now the immunity that was given to us via vaccines must have declined, and again we are facing the risk of acquiring infections?
No, that's unlikely because immunity doesn't wane that quickly, because there's also called as T cell immunity that is there. We have to understand in the COVID-19 infection, when it came on the scene in early 2020, we had not seen this virus before ever, SARS-CoV-2 virus. And then what happened was, when it infected people, the body has an inherent capability, what you call as immunity, to get rid of the virus. And that happens in roughly about 7 to 9 days. The body automatically gets rid of the virus. All of us are capable of doing that. But at that moment, we launched an immune response, what we called as a hyperimmune response. The body reacted too much to the virus than what it should ought to have. And that led to certain complications later beyond the 10th day of the infection. Now, because we have seen multiple variants of the virus by now, our population has been exposed to multiple variants of the virus. It is unlikely that in large number of people, our bodies would actually hyperreact to the virus. So therefore, what we are definitely going to observe, not going to observe, is hospitalization or things like that, or severe symptoms and things like that. That is very, very unlikely to happen now.
So talking about the hypothetical scenario, as you said, it is very, very unlikely that we are going to witness the same Delta wave what we have seen in India earlier. What are the chances? What are the changes that a virus goes through that makes virus even more deadlier? Does science works that way? Does virus evolves from being the weaker one like Omicron to again being a stronger one like a Delta?
General, I mean, I'm making a general statement. It's not a specific statement. In general, most viruses, what happens is that the initial infections, what happen, and that's also true for influenza and other viruses. The initial infections are much stronger. They have much more impact. But later on, over a period of time, the infections become milder and milder and milder. We have seen that happen in influenza as well. But then there are always new strain of viruses that can come about. Like for example, SARS-CoV-2 had a cousin called SARS-CoV-1. You know, we didn't see an outbreak of SARS-CoV-1. That was essentially mostly in cases in the eastern countries, but we did not see SARS-CoV-1 much in India. So what we expect, at least in SARS-CoV-2, there will be mutants which will keep arising periodically. There might be periodic outbreaks which will be of much milder variations, just like what we get in rainy season or in winter. We get common cold or flu-like symptoms and all. We may see infections of that kind because of SARS-CoV-2, because of the new variants that have arisen, but unlikely they would cause as much damage as what it did during the Delta wave or the first wave.
Okay. And to just cut it short, what should public do? I mean, these kind of reports generally create a panic or alarm among public. We are already a lot fatigued by pandemic. We don't want it to happen again. So what is the advice that a common man should follow with children at home, elderly at home, with people with immunocompromised status at home? What should they be doing right now?
See, what we learned from science is that this virus is airborne. Now, airborne virus means that a person infected, assume that I am infected, and when I speak or when I say things loudly or when I cough, I emit what are called as aerosols. You know, some part of the mucus from the mouth or nose or something that is emitted, and those particles are generally typically 5 microns to 10 microns in their diameter. 5 microns is 1,000th of a millimeter. 1 micron is 1,000th of a millimeter. So those small particles. And those particles trap virus and they keep remaining floating in the air. And that's how an uninfected person might accidentally inhale those particles and get infection. Now, this is science. So what this means is that, number one, people who have symptoms, they should not mingle with general public at large, so that the infection of their particles coming out of their mouth or nose are not there in the air immediately surrounding healthy people. Number two, ventilation plays a very important role in any building. If you keep all our windows open, fans on and all, even if these particles remain suspended in air, they would actually get dissipated in no time. And number three, if everyone wears a mask in densely populated areas or in markets or something like that, mask reduces the probability of the particles crossing the mask and inhaling the other one. So the precautions that general public should take are wear masks regularly in public. Number two, avoid large crowded areas as much as possible. And number three, if one has symptoms of cough, cold, slight fever or something, please avoid going to the general public, mingle with others so that you don't infect other people.
Doctor, will you suggest people to go for testing, COVID testing once again? Should they be going for testing if they have some symptoms?
I think that would be desirable, but we'll leave it to the professional doctors to suggest to the patients if they should get tested themselves for COVID or not.
Okay. Thank you, Dr. Mande, for those insights. While the current situation does not call for panic, staying informed and cautious remains the key. Thank you for watching.